So, would you like to know how to handle it a little bit more naturally without rotten side effects? It's not to get, we can't all get rid of our stress, but we can manage our stress. Okay? And we can give our body the fortification it needs to handle stress. So the brain produces decreased serotonin, we get sleep problems, depression and anxiety. Next slide. Our stomach, interesting, causes decreased hydrochloric acid and we get dysbiosis. Has anybody taken antacid in here? Okay.
And understand that serotonin is also produced in the stomach. I mean, it's,
In the gut.
It's very relatable, the gut problems.
Very good. Very good. So you find somebody who's depressed, do you think their digestion is messed up? Absolutely, it is. And so, if you're really depressed, look at the gut, okay? Because about 80%, maybe more, is produced in that whole digestive tract. So if you're taking an antacid, okay, should I go into this or not? Really quickly, if you're taking an antacid, the stomach has to be acidic. I want you to get that. You don't have to understand all the rest of this physiology, but understand the stomach must be acidic. It's how we break down proteins into amino acids. It's how we break down. We get rid of things like parasites.
Sorry, I didn't want to disrupt.
No problem. Come in and have a seat. It's how we break down parasites, get rid of parasites. That's how we digest a lot of things. Okay? So, the reason we take antacids, though, is because a very non-acidic stomach, a stomach that isn't acidic enough, doesn't allow the sphincter valve in the stomach to close properly. And when that valve doesn't close properly, we get acid from the stomach that's not acidic enough for the stomach, washing up into the esophagus, which is meant to be totally neutral. Do you follow that? Please raise your hand if that doesn't make sense or you missed it. Okay? So what I'm driving at is, the key is not, if you take ongoing antacids, there's sometimes a time and a place for them. And we have to pay attention to acid reflux, I'm not saying that. But really the answer to it is to help the stomach be acidic enough. Okay? Next slide. Yes.
Can I ask a question?
Yep.
I will every now and then take an antacid if I eat the wrong thing.
Yep.
Like tomatoes or ketchup.
Sure.
That just sends me into orbit.
And
sometimes.
that's not a big deal.
But I do take aloe vera juice.
Okay.
I have it in my refrigerator.
Good.
Just like you have aspirin on the shelf.
Aloe vera is very balmy.
Yes.
Very balm for the stomach, yes.
I've been told that I had a hiatal
Hiatal hernia, yeah.
and so I take a omeprazole capsule every day, and I was told that would hurt the acid reflux, and it does.
It does.
But am I giving some wrong information, or half?
No, it helps the acid reflux. It helps it in the sense that what washes up is no longer acidic. That's what's happening. What washes up into your esophagus is no longer acidic. But what about your digestion? It's not happening well. So it's a little bit taking omeprazole on a daily basis. Omeprazole is like Prilosec. It's an antacid or a proton pump inhibitor. It is going to make it so you don't get the good out of your food. So it's like having the IRS down in your stomach saying, oh cool, she's got 100 milligrams of vitamin C, I'm going to take 40% of that. How do you like that?